Hello.
Yay! Hello, everyone. We are here. We are back to Snack Chats. We are going to be talking about today. You can say no to being weighed. That is what we were talking about. I love it. Cool. Well, so if you are here, you may have accessed this video from our lovely Do Not Weigh Me cards. And if you have not, and you have no idea what I'm talking about, email us and we will send you one. But what is this little video about? It is basically Sarah and I explaining to you as a client the right and self-advocacy that you have to ask to not be weighed in medical appointments. And if you are a provider, it is going to provide you a little bit more insight into why clients are asking to not be weighed, or what criteria is needed medically for the potential of being weighed and steps that you can take to cause as little harm as possible. So that's what we're going to be talking about today. We also want to normalize this idea that it's okay to feel anxious and things like that about going to medical appointments, because a lot of them are revolving around weight. And so we are trying to debunk and kind of reinvent the wheel and make appointments very weight inclusive and weight neutral. So those are our intentions today. So
Awesome. Love it. Well, and Tina, can you get more into why someone might decline being weighed? So for providers out there who are like, why would a patient come in and refuse to be weighed or ask us not to weigh them? What would some of those reasons be?
yeah. So there are quite a few, and this list is not all inclusive, right? There may be other reasons, but these are the ones that we hear the most in regards to our own clients' lived experiences. So clients are wanting more trauma-informed care, and maybe they have struggles with their mental health or getting mental health support. And so one of the reasons would be that seeing or hearing the number can really be triggering. It can trigger their anxiety, potentially if they have an eating disorder, if they have any sort of obsessive thoughts around the number. So really, they're wanting providers to just not re-trigger these symptoms, or kind of come into it from a trauma-informed lens and do some prep work, which we will get into later. Another reason is that there's a lot of weight stigma and bias. So let's say an individual is really triggered by getting weighed. They may feel that the doctor is going to kind of create a top priority around the number. They're going to focus all medical care based on that number instead of looking at it more from a neutral lens. And so a client is wanting to avoid the stigma and bias and get very supportive medical treatment that has nothing to do with their weight, and or the weight is not influencing the treatment, right? Another reason is a client wants body autonomy. They have the medical right to say, I don't want you to obtain that information from me. I don't want to disclose it, right? And so this is 100% a right that clients have. Let's say there is a reason why weight needs to be obtained, let's say for potential dosage of a medication or something like that, then we are going to talk a little bit later about steps that you can take as a medical provider to keep this number non-disclosed to the client. Clinical relevance is another reason. For many reasons that people go to a doctor appointment or medical appointment, sore throat, skin rash, headache, whatever, you don't need a number, right? So why is that actually necessary? We don't necessarily go into every appointment and say, give me your entire medical history, right? So why do we need to obtain absolutely every sort of data point? And so this may be the reason why many clients are saying, I just want to focus on what's clinically relevant in this moment based on what I'm coming here for. And I want you to be able to honor that. So those, again, not a fully thorough list, but those are some temporary, reasons. But why don't you tell us what providers can ask for instead?
Yes, absolutely. So yeah, I think again, this can go for providers and clients advocating for themselves, but we ask providers to really focus instead of on the scale number, focusing on symptoms. So what the patient is showing up expressing that they're experiencing, function, right? Body functions. How are things functioning within the body? And we can look at that without looking at weight. Also vitals and labs, right? We can collect a lot of data on certain health markers that again are not based upon weight, and we can do a full assessment without even looking at somebody's weight. And so those are just a few things that um, patients, clients, whoever can ask for, providers can obtain in order to gather more information. We can also use a blind weight. And so if obtaining weight is medically necessary, which we'll talk about, there may be some cases where it is, but a provider can collect a blind weight. So that could be, the patient stands backwards on the scale, and then that number is not said out loud, and no paperwork that lists weight is provided to the patient. And this could be discussed, like, if certain papers get printed with that information expressing to the client or the patient, we're not going to share this particular paper with you today because it does list your weight unless you specify otherwise. Yeah. And then, patients can't, when requesting a blind weight or no weight at all, having this in the chart so that no matter which provider this patient sees, that is going to be honored and respected and not necessarily questioned. I think it takes a lot of times for a patient to advocate in that way in a medical setting. And so if it was just in the chart and they didn't have to continue asking for that every single time they went to the doctor, went to an appointment, or saw any sort of provider, I think that would also provide a lot of safety for patients in that setting.
That's our hope for these cards, is that clients could just hand these cards to providers so that they don't have to do the consistent emotional legwork of, here's the reasons why I have to continue to advocate for myself. Even if you don't agree, this is my right to ask. And so just handing the card is kind of taking over some of that emotional legwork there.
Mhm.
There are moments where a weight number may be clinically necessary. Um, this is a very nuanced area. We fully recognize that. But there may be points where that is. And so we do ask that as providers, though, that you're able to look at the weight through a neutral lens, not through a weight-centric lens. And so in these moments, some various moments are like medication dosage or procedures that rely on weight. Yes, this does exist. Certain anesthetics, and other sort of medical treatments, other medical, medications and things like that. Okay, great. But then we can also utilize what Sarah's talking about, obtaining that weight in a blind nature. Pregnancy care. This is a little nuanced, right? Some people are like, I don't want to be weighed throughout my whole pregnancy. Okay, I hear you. But there may be some fetal safety and monitoring that is needed. And so therefore needing to obtain the parent's weight during the pregnancy. Okay, fine. We can obtain it in a very neutral or blind manner. Fluid status. There potentially could be some fluid status concerns, heart failure, renal disease, kidney issues in that nature, where trends of weight guides the treatment. And so that is a nature where potentially we may be doing some exposure therapy with clients to really neutralize that number and recognize that maybe there is a lot of fluid retention happening. Pediatric and growth concerns is an area where we are and would want weight to be obtained, but we are really assessing it on more of a growth curve and trend status. That information is not and would not be disclosed to the client, but potentially the parents, and really providing guidance on that neutral manner. And then rapid and unexplained change. Anytime a client is coming into us and saying, like, my clothes aren't fitting, or I feel like I'm really gaining weight or losing weight, and I need someone to have eyes on this. Okay, great. We would really monitor this trend. And so that is very clinically appropriate to where we would be using that weight trend as a one tool to various others, because it is a symptom of something bigger, right? It is not the cause and main avenue of treatment, but it can allow us to build out a treatment plan. So it could potentially be clinically relevant. But again, in all of these clinical aspects, we really are going at it through a blind weight. So clients not seeing that, numbers not being verbalized, explaining and obtaining consent to why we are collecting that. And we really feel that it's clinically relevant, and then allowing for space and time to explain to the client or answer any questions that they may have to ensure that their safety is being honored. For
Absolutely.
medical
Yeah. And so I
providers,
wanted,
oh, I think there's a bit of a video delay. Yes.
that's okay. Hey, Tina, what were you going to say?
I don't even know. Sarah, you continue. I was going to say something along the lines of like, for medical providers, we are helping clients to be able to say this to the medical provider. So Sarah, you were going to share some little verbiage here to
Yeah.
the clients. Yeah.
Yeah, and I'm actually just gonna read straight from kind of our notes just for concise and clarity. So, anyone could like pause the video to write some down, anything like that. So, these are just a few prompts to practice advocating for yourself in medical settings. So they might sound like this. I decline being weighed today unless it is medically necessary for my care. If you do need it, please do a blind weight and don't say the number out loud. I would also add, and don't provide me with any paperwork that lists my weight on it. That could be something to add to that one. Another one, my weight can be triggering for me. Please focus on my symptoms and vitals unless weight is essential to dosing or decisions for today's visit. Please add to my chart, obtain weight only if medically necessary, use blind weight, do not announce the number or share the number. And finally, if you believe a weight is needed, can you explain how it will change today's plan? I love that.
Love that. So we're going to put these in the show notes so that you have it and you can actually copy and paste it somewhere, maybe in your phone's notes section, and literally like, I hear you, I'm going to read right out of my phone. That's totally normal and perfectly acceptable. So this is now for medical providers. So here are some little helpful tips for you. How can you help clients? You may say, let's ask for permission. Here's an example. Is it okay if we take your weight today? It may help with X, but we can also proceed without it. That is an option. That is actually obtaining consent and creating safety. You can also offer options. Today, I would like to obtain your weight for X reason. Here are the optional, choices here. We can go a blind weight. I cannot announce it. I can defer until it's clinically appropriate. What would you like to do? I can do all of them, right? And then document the preference. I know we keep saying this, but it is so important. A client may come in and advocate with one provider and then literally go and check out, and the nurse at the front desk hands them a piece of paper with the number on it. And so it's not quite creating the full circle. And then therefore the client did all this advocacy work, and then as they're leaving, they're triggered. So document the preference. This individual would like to avoid centering the visit on weight unless clinically and appropriate for their treatment. We want to keep language neutral and supportive, focusing on the presenting concern. An example, and a common one, is an individual is coming in for a sinus infection, a headache, something along those lines, congestion, and somehow their weight is brought into question. No, right? So let's be appropriate. Let's keep the treatment neutral.
Yep. Let's talk about maybe some instances where a provider might express a concern or want to obtain weight or is kind of pushing back on that advocacy work that the patient is doing. And then the patient can kind of get stuck, right? Because it's like, well, we need it for this. Is it actually medically necessary? Or, is this just a reason that they're expressing to obtain it? So one pushback might be insurance requires it, right? Insurance requires weight. And while insurance might require it often, or in some cases, not necessarily for every single visit. And so clarify with the provider whether obtaining weight would change like the coding that that provider might use for billing that visit, or if it would change the care provided on that day. So if it is still needed, again, if it is, yes, insurance does require this in order for the appointment to be covered. Again, we can utilize that blind weight and avoid announcing that number or sharing any paperwork with that number listed. So another reason could be this is our policy, right? This is the provider's policy. And so can we allow for accommodations with those policies, requesting chart notes and clinical rationale if a provider continues to insist? So, and
That one
then
hurts my soul, where I'm like, maybe you need to be reevaluating your policies, but okay, yeah.
And then finally, we need your BMI. So in that case, ask whether BMI, again, changes the care plan for that day, for that appointment. And if it doesn't, then you can decline being weighed or you can request a blind weight.
Again, challenging situations, we recognize it, but I hope that y'all can recognize that, which transitions nicely into the key takeaways. There's a lot of self-advocacy and medical rights here that you as the patient can advocate for, and you as the medical provider can allow your patients to advocate, right? There are a lot of loopholes as medical providers. We do not need to obtain this information, if ever, or at every appointment, right? So key takeaways today for a client: acknowledge your needs. Weights are triggering for me. Please, I do not want to be weighed today. That's appropriate. Ask for accommodations. Please skip the weight today. I am not in the mental space to be able to tolerate this. Or please make sure that I am being blind weighed, and that at checkout, please do not hand me that piece of paper. If it contains my weight, please read it and check. Align on necessity, making sure that you're checking in with the provider. Is this going to influence or change my care today? And is it necessary for my care today? Make sure that you're both on the same page. This is your appointment. The medical provider is not the leader of your treatment. You are. Approve or decline if needed. If essential, I will consent to blind weight, but please do not announce the number. Or I hear what you are saying, but it is my medical right and I am declining to be weighed today. Those are just some key takeaways, and I really want to encourage y'all to advocate for this in your medical care.
Yep. So just to kind of recap everything we touched on today, which was a lot, just patients, remember clients, patients, humans, remember that you can set boundaries when you're in medical settings, right? There are ways that we can respectfully honor patient and client needs while also understanding like clinical needs and how we can find a nice balance between those things. So yeah, just keeping that in mind. And we'd love if anyone would like to share their lived experience, comment below, share maybe how you advocate for yourself, or whether this was helpful so that you can advocate for yourself in the future. And be sure to check out our website and future episodes that we'll be doing, just talking about weight neutral care and trauma informed care.
We are going to link a PDF printout of this card that you could print and take to your medical provider. But if you are wanting a card and us to provide that to you, if you do not have access to printing or anything like that, please, you can email us. The email will be in the show notes, or you can always contact us through our website and we will send you one. Thanks for listening, y'all. Have a great day. Bye.
Bye.